All right. So Chapter 18, Lifespan Considerations in Dosage Calculation. This covers pediatric dosages, which we've already discussed when we calculate how many milligrams per kilogram that we're giving our patient. I think it was Chapter 11 that we covered that. And then it also discusses considerations for pregnant patients as well as the older client. And there's also some concepts in here that we're going to skip over. So we'll just talk through these quickly and do some practice problems and go from there. So general considerations for children. Basically, most of our calculations for children that you guys are going to be doing will be based on body weight. So we're going to skip over the body surface area calculations because those are for a more higher level of nursing, or the physicians are going to do those calculations and you'll just be double checking them as an RN. So we will skip those. But starting with dosages for infants and children using body weight on page 372. So the table at the bottom of that page explains and discusses why it's so important for us to get exact calculations based on body weight for administering medications to children. And it talks about the alterations related to age on the different organ and body systems, and then its effect on the medications. So if you look down there, it talks about infants and children. They have a high water content relative to fat content as compared to adults. So we can see an increased dilution of water-soluble drugs, leading to decreased level of that medication in the bloodstream, and then an increased level of fat-soluble drugs. GI system, we have a slowed gastric emptying time, so therefore that medicine is going to stay in their stomach longer and more of that medicine would be able to be absorbed. So that could be different than an adult, which it might empty quicker and not as much of that medicine would be absorbed. The kidneys, as an infant, kidneys are not fully developed, so there's an immature kidney function leading to slowed excretion of the medicine. So if there are medications that are administered that are metabolized by the kidneys, we have to be very careful the younger the child is, because that could be damaging to the kidneys. A big one is ibuprofen. You never want to give ibuprofen to an infant that's 6 months or less. So you want to wait until at least they're 6 months of age so their kidneys can excrete that properly. The liver is also immature, and therefore there's, the enzymes that the liver produces are not as that of an adult. So you're going to see increased levels of the drug in serum as well as slowed metabolism. So a medication such as Tylenol that's metabolized in the liver, you definitely want to watch how much of that medication the child has received to prevent from that liver involvement and damage to the liver. So I'm sure you know that, say your child has a fever and, a nasty cold and a fever, just for the sake of example, and you give your child Tylenol for your fever or for their fever, and then they've got, that congestion and sinus stuff. And so you might want to give them some over-the-counter sinus medication. Well, you need to make sure you look in that list of ingredients and make sure there's not Tylenol in that, because commonly, like NyQuil or something like that, would have Tylenol in it, and you would double dose them and potentially give them too much Tylenol that could damage the liver. Does that make sense? It talks about muscles as well, underdeveloped musculature. That's going to involve medications that we administer by IM or intramuscular injection. So based on the child's size, we need to be mindful about the amount of medicine that we inject as well as the absorption of that medication. Their skin is thinner, so they're more likely to absorb topical medication. So overdose of topical medications could come into play. And then the brain, immature blood-brain barrier, so we could see altered CNS functions. So those are just some differences between adults and children that we have to be aware of when we administer medicines. So, like I said, this first part is calculating dosages for infants and children using body weight. So example 1 on 372, provider orders Zofran 0.15 milligrams per kilogram IV 30 minutes prior to chemotherapy. Patient weighs 36 kilograms. Calculate the dosage in milligrams of Zofran to be administered and round to the nearest tenth. So do you guys remember these type of problems? Very basic. So you're going to set up your dimensional analysis starting with milligrams, include the milligram per kilogram order, then include how much your patient weighs and solve for milligrams. So we all remember how to do that, where we should. And then the difference is, in this chapter, they talk about when your problems discuss dividing the doses out throughout the day. And then back in chapter 11, we kind of didn't discuss that, but the problems were on your homework and we had that post discussion, unfortunately. So this is an example of those. So we'll do example 3 on 373. So provider orders ampicillin, 200 milligrams per kilogram per day, IV, divided every 8 hours. The patient weighs 4.1 kilograms. Calculate the dosage in milligrams per dose of ampicillin the patient should receive and round the answer to the nearest tenth. Okay? So we're solving for milligrams per dose. I'm going to start with milligrams on top, right? So in our problem, it tells us that we have ordered 200 milligrams per kilogram per day. So 200 milligrams per kilogram per day. Now, remember, we talked about last time, since these two are on the bottom, you can start with either one of those. I think someone wanted to start with kilograms and another person wanted to start with days. It doesn't matter which one we use. Let's start with the first one, kilograms. How many kilograms does our patient weigh? 4.1. And I'm going to put it over 1 as a placeholder, so that cancels out my kilograms. I've got milligrams on top, days on bottom, but I want dose on the bottom. Okay, so what in my problem do I need to do to remedy that?
You need to put 24 hours in a day.
Okay, 1 day.
24 hours.
24 hours.
Mm-hmm.
Okay, so I've got milligrams on top, hours on bottom.
Okay, so then you're gonna have 8 hours over 1 dose.
8 hours per dose,
Per
because
dose.
you've got 8 hours with, okay.
8 hours per dose.
So that cancels out hours. I got dose on bottom, milligram on top. So you should have 200 times 4.1 times 8 on the top and 24 on the bottom.
Yeah, 65, 60 is the top.
Okay. 65, 60 divided by 24.
repeating.
273 repeating, 0.3 repeating. So I'm rounding to what? The 10th? Here's my 10th spot. So that becomes
273.3.
273.3. Maria and Martini, that's not backwards for you, is it? Can you see it correctly? Okay, good.
Yeah, I can
Sure.
see it.
Good. Okay, so questions so far? Awesome. So you feel fairly comfortable with these. The important thing to remember is like the alert on 374, towards the bottom, a dose received every 8 hours is equal to 3 doses per day, not eight doses per day, because you have to remember 24 hours in a day, and depending on how many doses per day they are wanting. So if you did 6 doses per day, how often would you get a dose? How many hours? Every 4 hours. Okay. All right. Example. Yeah, I was going to do either 4 or 5. Let's do number 5. So example 5 on 375. Okay. A provider orders vancomycin 40 milligrams per kilogram per day, IV in 6 divided doses. The patient weighs 16.3 kilograms. Calculate the dosage in milligrams per dose of vancomycin to be administered and round the answer to the nearest tenth. Okay, so once again, I'm solving for milligrams per dose. And the order that has been given to us is 40 milligrams per kilogram per day, right? So that's going to be my first ratio. And then to cancel out kilograms, how much does my patient weigh? 16.3, so they got rid of my kilograms. I've got day, but I want dose, right? So what do I put about day here? For one day, how many doses did they tell us to give? 6 divided doses. That cancels out day. I've got milligrams on top, dose on bottom. So 40 times 16.3 is how much? 652?
Yes.
And then I've got 6 on the bottom. So 652 divided by 6? 108.6 repeating. Okay. Rounding to the 10th. No. You've got 6 to the right of the 10th spot. So that means you go up 1. So it's 108.7 milligrams per dose. So since that one didn't tell us to give it every 6 hours, instead it gave us, we're giving a total of 6 doses. That's why we had to use that conversion for that. Okay. Okay, so if you turn the page to 376, example number 6, the pharmacy supplies vancomycin in vials containing 250 milligrams per milliliter. Using the dose calculated in example 5, so this is our answer. We're using this answer to calculate how many milliliters I'm going to administer per dose. Okay?
It's going to sound really weird, but it's like bringing an extra marker.
Can you spell it?
Yeah.
This one?
I
It
feel
was
like I'm
strong
crazy because I'm just smelling Expo over here, and I was like, that's me.
It's pretty potent. Okay. So I'm going to erase our work except for the answer. So this is the answer I got for number 5. So I'm going to take this 108.7 milligrams per dose and figure out how many milliliters am I going to administer if this is my dose. Okay? So I'm solving for milliliters, so I know I'm going to need milliliters in my first ratio. And it tells us that we have a supply of vials that contain 250 milligrams per milliliter. So every 1 milliliter, I have 250 milligrams, right? Now, I want to cancel out milligrams, okay? So this is where I'm going to take my answer from number 5. I'm supposed to give 108.7 milligrams for every dose, right? So 108.7 milligrams, and you can put 1 dose under here if you want. So I've got milligrams, or you can just put 1 to hold the place. So this should be milliliters on top, dose is on bottom, but I'm trying to solve for how many milliliters I'm going to administer per dose. So that's okay. Do you understand why I can leave that there? Or I can just not put it there at all. Okay. So 108.7 divided by 250. And I got 0.4348. Did it tell us to round to the 10th or the 100th? 100th. Here's the 100th spot. 4 is to the right of it, so my final answer is 0.43 milliliters. So that's how much I'm going to administer to my child. So does that 2-step process make sense? So first they told us we have to give so many milligrams per kilogram a day, and we found out how much per dose. So then this became the amount we're wanting to give, and we used what we had available to determine how many milliliters this would be. Okay, so if you look on 376, the practice questions have those 2-step problems for us to complete. Okay, so let's do one of those before we move on to make sure we feel comfortable. And let's do number 2 on 376. I'm going to let you guys work this on your own, and then we'll do it together. 2-step problem, number 2. Okay, let's see what we got on number 2. So a provider orders Cipro 20 milligrams per kilogram per day by mouth in 2 divided doses in 24 hours. The patient weighs 44 kilograms. The pharmacy supplies Cipro in an oral suspension containing 500 milligrams per 5 milliliters. So the first thing we're trying to solve for A is milligrams per dose, right? So what do I know about milligrams? What? We have what? 20 milligrams? Okay. What do I want to do next?
44 kilogram.
Okay. Do I need to do something about the day? So for one day, I have 2 doses. Is that what you guys got? Okay. So I've got milligrams on top. I've canceled out my day, and I've got dose on bottom. Okay. So 20 times 44 on top and 2 on the bottom, right? What you got? So 880 divided by 2. So you should be administering 440 milligrams per dose. Okay, did everyone get that? What's you? Okay, so 440 milligrams. Is our answer for A. Now for B, it says, how many milliliters will we be in? Okay, so I start with what? Milliliters? What do we have available?
5.
5 milliliters, and in that 5 milliliters, how many milligrams do we have?
500.
Yes. Okay, I've got milliliters on top. I want to get rid of the milligrams. So that's when our answer to A comes into place. So 440 milligrams for one dose. So milligrams cancel out, milliliters on top. So I have 5 times 440.
4.4.
So 2,200 divided by 500 is 4.4. So you'd be giving 4.4 milliliters per dose. You guys feel comfortable with that so far?
Yes.
Good, good. Okay, so on page 377, it starts talking about body surface area. And remember, we're skipping over that. That gets us to page 381, controlling IV infusions for children. These infusions we talked about a little bit when we started talking about milliliters per hour in the very beginning. And remember all that equipment that I brought into the class? It talks about we can administer IV infusions by infusion pumps, micro drip tubing, and volume control sets. And so I brought all 3 of those things in here just to show you. You know what an IV pump is, and for kids, we want specific IV pumps or the ability to set the IV pump at a lower pressure. Oh, that scared me. Sorry. I thought it was something outside. It sounded like someone spraying Lysol. So IV pumps for kids need to be administered, or the pressure needs to be lower than adults to reduce fluid volume overload or infiltration of that medicine into the tissues instead of into the vein. So micro drip tubing is that the tubing that I showed you that had the really, really small drips coming out, that 60 drop set. And then the volume control set was the IV tubing that had that cylinder attached to it. And you're only going to put like 1 or 2 hours worth of IV fluids within that cylinder and then close it off. So to reduce the risk of fluid volume overload in those children. So that's what it's talking about there. Calculating maintenance IV fluids for children. I'm not going to test you over these, but I just want you to be aware of them. We're like I said, I'm not going to put that on your test this week, but it talks about calculation of daily maintenance fluids. So you can review this on page 382. There's a table for pediatric daily maintenance fluid needs for infants, toddlers, and children. So these are basically the way that we can calculate how much fluid a child needs to maintain their normal level of hydration. So this is not going to be for a kid that's already dehydrated. It's just going to be for a child, say, that needs to be on NPO status or nothing by mouth status. If they're going to have surgery or they're, for whatever reason that they're sick, that they're not taking enough by mouth, then we would calculate that based on body weight, how many milliliters per kilogram we would administer to keep up their normal hydration. Okay. So it shows those calculations there. And then on page 386, it talks about considerations for pregnant and lactating women. And this is not calculations, it's just general information for you guys to be aware of. But while women are pregnant, their bodies undergo a lot of changes. And part of that change is an increase in fluid volume in their bodies, namely blood. And so with the increase in blood volume, you see on the table 18.3 on 386, since there's an increased blood volume and increased cardiac output, the effect on medication, absorption, distribution, metabolism, or excretion, we have a greater distribution throughout the body of medications. The GI system, they have an increased hydrochloric acid production. So that's going to alter the absorption of some medications. Nausea and vomiting. If the patient's continually vomiting, then they're not going to be able to absorb medications that they need to. Kidneys, there's an increased blood flow to the kidneys and an increased filtration rate of substances. So that's going to mean that a pregnant woman is going to have an increased excretion of medications that are metabolized by the kidneys. Liver, placenta and fetal liver contribute toward metabolism. So you would have an increased metabolism of drugs that are metabolized in the liver. So you can kind of see how pregnancy is going to alter the way that medications are absorbed and excreted and whatnot throughout the body. They mentioned drug use during lactation. Most drugs can be transmitted from the mom to the baby through the breast milk. So it's very important to be aware of what you're taking into your bodies and, just be aware that medicine can transfer to the child. For aging adults, it mentions persons aged 65 and older represent 14.5% of the total population of the U.S., but 1/3, or about 33%, of all prescriptions are by that age group. So, they do take a lot of medications statistically. And for older adults, different medications can have more impactful effects than just a normal middle-aged adult. Certain medication types can alter cognitive status. leading to increased risk of injuries. So think of pain medicine that your patient might be on that might have increased central nervous system depression. They might fall more, be less stable, be less aware. They might be, more sedated with that use of medicine. Diuretics may cause confusion in older adults. Declining organ function can alter how medicines are absorbed, distributed, metabolized, and excreted, just like with pregnancy and children. And then low body mass index, requiring lower dosages. So the table on 18.5 talks about changes in organ function related to aging and how medication use would be affected. So kind of the opposite of pregnant women, kidneys, there's a decreased blood flow, reduced filtration rate, and decreased number of functioning nephrons. So the excretion of medications is going to be decreased. So if the excretion is decreased, what would our patients be at risk for? What? Yeah, toxicity. Yeah, so too much medicine that'll build up in their system, as well as liver. If there's decreased blood flow to the liver and the liver's not functioning as well, then you can get hepatotoxic with that way as well. One thing I didn't mention, I skipped over on the bottom of 387, FDA pregnancy categories. Medications are given a pregnancy category, A, B, C, D, and X. So the way to remember that, pregnancy category A, there are well-controlled, adequate studies that have shown no risk to the fetus in the first trimester of pregnancy and no risk in later trimesters of pregnancy. So basically these medications are safe for pregnant women to use during pregnancy. So pregnancy category A, okay, they're good to use. And then you can read B, C, and D, and then X, think of X is a big no. So X, studies in animals or humans have demonstrated fetal abnormalities and or there is positive evidence of human fetal risk based on adverse reaction data from different experiences or studies. And the risks involved in use of the drug in pregnant women clearly outweigh the benefits. So any medication that's pregnancy category X, you would not want to administer to a pregnant woman, or they don't even need to handle those medications. So if you are pregnant as a nurse and the medication is a pregnancy category X, you would not even want to handle those with bare hands in case you were to absorb some of that through your skin, because it could be, potentially harmful to the fetus. So just things to keep in mind. Okay, that's the end of that chapter. So it was kind of a quick day today. If you guys will look on, I'm going to share my screen, guys. Maybe. Okay, so this week for week 13, we have chapter 18 homework and a chapter 18 exam. Okay, so just like usual, and then you're going to see 4 other items on the activities for this week. So the first one that's listed is a practice comprehensive final exam. Okay, so this exam is going to be a practice that's going to be just like your regular comprehensive final. So you've got a total of 50 questions. I've given you 150 minutes to complete it. So that's 3 minutes a question. And I increased that a little bit for you guys just to ease some anxiety. Because keep in mind those problems that we did very early on in the semester don't take a whole lot of time if we're just converting like kilograms to pounds or something like that. And then the problems like we did today are a little bit longer and might take you a few more minutes. So it should all average out and you should have plenty of time to just pace yourself and get through those 50 questions. So this is for a grade, 100 points. So take your time, okay, when you do this. And this practice exam is going to give you a very good indication of how you're going to do on the real comprehensive final. Okay, so remember that comprehensive final, you have to make a 90%, but you've got 3 attempts to do it in. Okay.
Will you be able to do the comprehensive when we're done with it?
When you're done with it, I'll set it to where you can review it to see what you missed. Yes, I'll definitely do that. And if I forget, I'll try to, let's set that right now.
So, question, because I never know. Whenever you make your questions on the exams, you always do like a blank and then you put milligrams or milligrams per dose or whatever it may be that we're looking for. Do we still need to in our answer put 15 milligrams, or can we just put 15 since it's implied that it's that blank?
You can just put the answer. That's okay. Yeah, you don't have to put the label if you don't want to. It's perfectly fine. So practice comprehensive final, sorry. And then you have extra practice questions for the comprehensive final exam that you'll see listed there. And when you open those, you should see, you're going to download it next to action, and then you should see the exam key after that. So you'll be able to check your answers. And then going back, you've got a bonus point opportunity. So you can get 25 bonus points if you complete those questions and upload them to me. Once you upload them as an assignment, then I will return the answer key to you. But that's just an easy way just to incentivize you to practice and get additional help in there. And then there's also a comprehensive final study guide. So that will give you some topics and reminders for the exam. Okay, so if you look at next week is the comprehensive final exam attempt 1. Okay, so it will open on Monday morning at midnight and it will close at Saturday at midnight. So you have 1 week to take your first attempt at that final exam. And like we talked about last week, you can take that at home. Okay. So we're not going to have class Monday. Today is the last regular day of class. However, I'm going to stop presenting here. However, I will still be here on campus. Okay. So if you guys want to meet with me, I'll be in my office in the office suite, and we can go over anything you want to go over, or if enough of, if a bunch of you want to come in here, come get me and we can do, go over questions that you had difficulty with. I don't mind doing that either. Okay. And then, so I will be here next Monday. We just won't have class next Monday. I'll just be available for review or one-on-one help. Okay. You guys have any questions, Maria Martini? Okay.
No,
All right. Well, that's all we have. Yeah, everyone misses you guys. They say it's so empty without you here.
Martini always makes my day.
Okay, that's it. I will see you guys later, okay?
Mrs. Wilson,
Yes,
I also, we've got COVID in our building
right.
and I'm trying to distance. Is this okay?
Hold on. Let me